Being a caregiver for someone you know and love can be very rewarding, but it can also be exhausting and frustrating. Caregiver burnout is a state of physical, emotional, and mental exhaustion. It may go along with a change in attitude, from positive and caring to negative and unconcerned. Caregiver burnout is very common. Studies have shown that 40% of caregivers felt emotionally stressed, 20% said caused financial problems, and 20% felt physically strained. Almost every caregiver experiences burnout at some point. Caregiver burnout is harmful to the person receiving care as well as to the caregiver. If caregiver burnout happens and is not addressed, the caregiver will eventually be unable to provide good care. Burnout can happen when you don't get the help you need, or if you try to do more than you're able, either physically or financially. There are many causes of caregiver burnout. One is caregivers often are so busy caring for others that they tend to neglect themselves. Another, role confusion. You may feel confused to be a caregiver. It can be hard to separate this role from the one of spouse, child, or friend. Also, you can have unrealistic expectations. You may expect your care to have a positive effect on the health and happiness of the person you care for. This may be unrealistic for patients who have a long progressive disease such as Parkinson's or Alzheimer's. You can also experience lack of control. It can be frustrating to deal with lacking the money, resources, and skills to manage your loved one's care well. You can also have unreasonable demands. You may take on too much, partly because you see providing care as your job alone. Some other factors may be that you may not recognize when you're burnt out and get to the point where you can't function well. You may even get sick yourself. There are many warning signs before burnout occurs. Being aware of and watching for them also lets you know when you need to take steps to combat or prevent stress you're experiencing. The symptoms of caregiver burnout are much like the symptoms of stress and depression. Withdrawal from friends and family. Loss of interest in activities you used to enjoy. Feeling blue, cranky, hopeless, and helpless. Changes in appetite, weight, or both. Changes in sleep patterns. Neglecting your needs and health. Getting sick now more often. Using alcohol or sleep medications too much. Feelings of wanting to hurt yourself or the person for whom you are caring. Emotional and physical exhaustion. Some physical symptoms you may experience are body aches, fatigue, frequent headaches, increased or decreased appetite. Some emotional symptoms you may experience that are less likely to be recognized are anxiety, becoming angry and argumentative, becoming irritated easily and often, constant worry, depression, feeling hopeless, impatience, inability to concentrate, isolating yourself emotionally and physically, lack of interest in things that used to make you happy, and lack of motivation. How can you prevent caregiver burnout? It's important to be aware of the warning signs of caregiver burnout, to recognize when you have them. There are a number of things you can do to take care of yourself, stay healthy, and prevent burnout. One is ask others for help. Remember that you don't have to do everything. It's okay to ask friends and family to do some of your caregiving tasks. Another is get support. Talking about what you're going through and getting support from family and friends or support group helps you to process your feelings and emotions. Holding everything in can make you depressed and contribute to feeling overwhelmed. Consider seeking professional counseling if necessary. Also be honest with yourself. Know what you can and can't do. Do the tasks that you can and delegate the rest to others. Say no when you think a task will be too stressful or you don't have time to do it. Another is talk to other caregivers. This helps you get support as well as allowing you to give support and encouragement to others going through something similar as you. Another is take regular breaks. Breaks help you relieve some of your stress and restore your energy. Use the time to do things that relax you and improve your mood. Even a 10-minute break can help. Another is attend social activities. Meeting with friends, continuing your hobbies, and doing things you enjoy are important to maintain your happiness and avoid isolating yourself. This activity should be something that gets you away from the daily routine and setting of caregiving. Another is pay attention to your feelings and needs. It's easy to forget to take care of your needs. When you're a caretaker, it's important to focus on yourself regularly and take care of your needs. Another is take care of your health. Keep your regular doctor appointments, including for preventative care. Take your medications and see your doctor when you feel sick. If you aren't healthy, you can't take care of someone else. Another is eat a healthy diet. Eating nutritious meals keeps you healthy and improves your energy and stamina. Avoid junk food, which can make you feel sluggish. Another is exercise. Exercise is a great way to relieve stress, increase energy, and take time for yourself. It can also improve depression. Another is maintain your sleep schedule. Getting enough rest is important for your well-being and to maintain your stamina. Another is take family leave. If you work, make use of family leave benefits available to you. Removing the stress of work can reduce your responsibilities and free up more time for yourself. And lastly, consider respite care. When you need a break, using respite care for a few hours to a few weeks is an option in most places. When you need a few hours or day for yourself, in-home services such as home health aid or an adult day center can take care of your loved one. A residential care facility provides overnight care if you need a longer break. The drawback is that you may pay a fee for these services that usually isn't covered by Medicare or insurance. So, maintaining a healthy mind, body, and spirit is essential for the well-being for both of you and your loved one. Take care of yourself so that you can take care of others. I've also attached a caregiver assessment questionnaire where you can self-evaluate to see how you are doing, and they also list some recommendations and valuable resources.